What exactly is your body trying to accomplish when it hiccups? Picture this. You're sitting quietly, doing absolutely nothing remarkable. Maybe you've just eaten, maybe you're talking, maybe you're staring into space while pretending to listen to someone. Then your chest jerks. A few seconds later, it happens again. Now everyone nearby is waiting for the next one, including you, which somehow makes it worse. You hold your breath. Someone tells you to drink water upside down. Another person suggests being frightened, as though one involuntary body malfunction might be cured by adding panic. But hiccups are stranger than they seem. Your body doesn't just twitch randomly. It performs a sequence. A muscle below your lungs contracts. Air rushes inward. Your throat closes at exactly the right moment to cut that breath short. That's an odd amount of coordination for something supposedly meaningless. A sneeze clears irritants. A cough protects the airway. A blink protects the eye. But a hiccup appears, makes a noise, interrupts your sentence, and leaves without explaining what service it provided. It behaves less like an accident and more like a forgotten instruction. So what is that instruction for? The usual explanation is simple. Your diaphragm spasms. And that's true. Mostly. Your diaphragm is the broad sheet of muscle beneath your lungs. Normally, it contracts smoothly and moves downward, helping the lungs expand. During a hiccup, it contracts suddenly. That movement pulls air into your throat. Then your glottis, the opening between your vocal cords, closes almost immediately. The closure cuts off the incoming air. That's what creates the sound. So the diaphragm creates the movement, but the throat supplies the tiny percussion instrument. Mystery solved. Except it isn't. Saying hiccups happen because the diaphragm spasms is like saying a car crash happens because two bumpers touch. Technically correct, not especially satisfying. The diaphragm contracts because nerves tell it to. Follow those signals backward and hiccups stop looking like one twitchy muscle. They become a neurological reflex. Researchers often call it the hiccup reflex arc. It isn't one nerve. It's more like a badly organized group chat involving the brain, chest, throat, stomach, and diaphragm. Signals can enter through the vagus nerve, the phrenic nerves, and nerves connected to the chest and abdomen. That gives the hiccup system an enormous number of possible doorbells. The stomach can ring it, the esophagus can ring it, the throat can ring it. Even irritation inside the ear has occasionally been connected to hiccups, because one branch of the vagus nerve passes through that area. The vagus nerve is not known for respecting boundaries. This helps explain why so many ordinary things can trigger hiccups. Eating too quickly stretches the stomach. Carbonated drinks add gas. Alcohol and spicy food may irritate nearby tissues. Laughing changes your breathing and makes you swallow air. Excitement can alter respiration and nervous system activity. These things don't physically punch the diaphragm. They disturb the network controlling it. Once the reflex fires, signals travel through the phrenic nerves and activate the diaphragm. Other nerves help close the glottis. The result is one hiccup, then another, then perhaps 15 more, because the nervous system sometimes mistakes repetition for commitment. But even that only explains the machinery. It doesn't explain why we have it. And this is where hiccups become much stranger. Hiccups begin before birth. Fetuses hiccup in the womb long before their lungs are used to breathe air. Premature babies hiccup frequently. In general, hiccups are far more common early in life than in adulthood. That creates a problem for the idea that hiccups are merely a digestive accident. A fetus isn't drinking soda. It isn't inhaling nachos. It hasn't become nervous during a job interview. Yet the reflex is already active. So perhaps hiccups aren't useless. Perhaps we're simply looking at them too late. One possibility is that hiccups help the developing brain learn about breathing.
When the diaphragm contracts in a newborn, the brain receives sensory information about what moved and how it felt. Studies of newborn brain activity have found distinct electrical responses following hiccups. That has led researchers to suggest that repeated contractions may help the brain map the muscles involved in respiration. Think of it as equipment testing. Diaphragm moved. Signal received. Circuit identified. In a newborn, that could be useful. In an adult attempting to drink coffee,
less so. There's another theory. Young mammals often swallow air while feeding. That air occupies stomach space that could otherwise hold milk. Some researchers have proposed that hiccups help move swallowed air upward while the closed glottis protects the airway. In other words, hiccups may once have been part of an infant maintenance system. Burping, but with unnecessary branding. That could explain why hiccups are common in babies and less frequent with age. But there's an even stranger possibility. The hiccup pattern resembles an ancient form of breathing used by animals that move water across gills. In those animals, muscles draw fluid inward, then the glottis closes to keep it from entering the lungs. The sequence resembles a hiccup, sudden inward movement followed by rapid closure of the throat. Some researchers have suggested that hiccups use ancient neural circuitry inherited from distant aquatic ancestors. Not because your body is trying to regrow gills. That would require additional paperwork. But evolution rarely rebuilds everything from scratch. It modifies old circuits and sometimes leaves behind behaviors that make more sense in the history of the body than in the body itself. A hiccup could be a relic, an ancient breathing pattern preserved inside a modern nervous system, perhaps later adapted for feeding or grain development. The tiny noise interrupting your dinner may involve circuitry older than mammals, possibly older than the first animals that lived entirely on land. But this is where we have to be careful. Scientists don't know exactly why hiccups evolved. The developmental theory is plausible. The infant feeding theory is plausible. The ancient breathing theory is plausible. They may overlap. An old respiratory circuit could have been reused in mammals for feeding, development, or both. But none of these ideas has been proved as the single explanation. We understand the mechanics much better than the purpose. We know the diaphragm contracts suddenly. We know the glottis closes immediately afterward. We know stomach expansion, irritation, laughter, stress, and rapid eating can trigger the reflex. We know fetuses and newborns hiccup far more often than adults. What we don't know is whether adult hiccups still serve any useful function. They may simply be a reflex that mattered early in life and never disappeared completely. Most hiccups stop once the irritation fades, and the nervous system suppresses the loop. Many remedies try to interrupt it. Holding your breath changes carbon dioxide levels. Drinking water alters swallowing and breathing. Swallowing sugar stimulates nerves in the mouth and throat. A sudden fright changes breathing, although it may also reduce the number of people willing to help you. Sometimes these tricks seem to work. Sometimes the hiccups were already ending, and the glass of water receives credit for being nearby. Most hiccups are harmless, but hiccups lasting more than 2 days can result from illness, medication, surgery, irritation, or damage somewhere along the reflex pathway. Because that pathway stretches from the brain through the throat, chest, and abdomen, persistent hiccups can occasionally signal a larger medical problem. So what causes them? A hiccup begins when something activates a reflex network linking the brain, diaphragm, throat, chest, and digestive system. The diaphragm contracts. Air rushes inward. The glottis snaps shut. The sound escapes. But the reason that reflex exists is still unresolved. It may help the newborn brain learn to control breathing. It may help nursing mammals clear swallowed air. It may contain the remains of an ancient respiratory system inherited from animals that once moved water across gills. Or it may be all three, layered together across millions of years. So the next time your body interrupts a sentence with a hiccup, remember this. It may feel like a meaningless glitch, but it could be an ancient program still running long after we forgot what it was designed to do. Are earthquakes and hiccups similar? That's going to bug you like a hiccup now, isn't it? It's okay. We've got you covered. Check out our last video. Why do earthquakes happen?